I chose to do my presentation on the research publication titled Effectiveness of Simulation-Based Nursing Education Depending on Fidelity, a Meta-Analysis. Simulation provides nursing students with the opportunity to practice clinical skills and critical thinking skills by utilizing real-life scenarios. This does not compromise patient safety. New and experienced nurses can be trained using simulation to develop technical and non-technical skills. Specific and unique patient situations can be presented and the correction of errors can occur. What this means to me is that simulation can be used to teach nursing students and allow them to learn and grow without compromising patient safety. Additional advantages of simulation include providing immediate feedback, allowing repetitive practice, promoting active learning, permitting adjusting difficulty level, individualizing learning, and enhancing learning through a variety of interventions. I want to add that the simulation environment is a safe environment. This makes it okay for nursing students to make mistakes. Simulation is a learning technology. Mistakes will be made. The main goal of this is to ease student anxiety, increase their confidence, and overall, if they learn something, we have achieved something. The purpose of this study was to determine the effect size of simulation-based learning in nursing and compare effect sizes to the fidelity level of the mannequin simulators through a meta-analysis. This study wants to know how much fidelity matters. I included this picture to give a better understanding of the simulation environment. It is very realistic with real medications, real medical equipment, monitors, and varying degrees of technology. Technology is widely used in simulation at varying degrees. High-fidelity simulators are computerized mannequins that mimic real-life situations and are used for hands-on practice. Low-fidelity lack real-life experiences but allow students to grasp smaller concepts. So many of the mannequins are computer-based patients. Technical skills such as IV, catheter insertion, and dressing change can be learned, and non-technical skills can also be learned, including communication and teamwork. Nursing skills as well as patient scenarios can be presented utilizing technology. I want to add my personal experience of using technology in the simulation lab. So the mannequins are hooked up to their own monitor. This monitor controls the breath sounds, the vital signs, the pulse, the respirations, the bowel sounds of the patient. Then there is a monitor that is synced to an iPad where I will hold the iPad, and based on the nursing care that they provide, I can adjust the vital signs of the patient. So as you can see, there is a lot of technology used in the simulation lab. And I also want to explain high fidelity mannequins. These are incredible. They can actually talk and interact and answer questions. They can sweat. They can urinate. Technology has truly changed simulation, and it to me is honestly amazing to see what some of these mannequins can do. I included some information on the method of the study. Reliability was maintained. What I want to focus on is that the study did take into consideration the differences between low, medium, and high fidelity. They even considered hybrid simulators. So low fidelity was defined as static models or task trainers. Medium fidelity was defined as full-body mannequins with embedded software controlled by external handheld devices, and high fidelity was defined as life-size computerized mannequins with realistic structures and high response fidelity. Some information to take into consideration when analyzing the results was that high-fidelity simulators were used in 50% of the studies. 25% of the studies used standardized patients. So knowing this, the study results showed that simulation use in nursing is effective. High fidelity is more effective than low fidelity. Realism does affect learning, and student participation enhances learning attitudes. Satisfaction of students is the highest in standardized patients. High-fidelity simulators and standardized patients improve cognitive and affective outcomes. For psychomotor learning outcomes, medium-fidelity simulators were more helpful. What this means to me is that as a future nurse educator, the degree of fidelity does matter. Often we assume that the most and the highest is always the best, but this might not always be the case. For instance, student participation enhances learning attitudes. Well, I'm a big believer in that the learning environment affects student learning. So if the learning attitudes are better of students, their learning will be better. This is important because I am a graduate assistant in the simulation lab at ETSU, and I think this is something we could work on by varying the degree of fidelity based on the task and goal we want to achieve. The limitation of this study was debriefing. Debriefing was inconsistent. So debriefing occurs after the simulation is ran. So we go over what went great, what went wrong, what we would change. Maybe a skill was performed inappropriately and we can fix that. We go over nursing outcomes, nursing interventions, nursing diagnoses, and so much more. So this to me is a big problem of this study because maybe debriefing wasn't handled correctly and that altered the results. It can be concluded from this study that simulation is effective, especially in the psychomotor domain. The clinical reasoning process needs to be improved to increase learning in the cognitive domain for simulation. Educational intervention should vary to fulfill goals and outcomes. Debriefing is an essential part of simulation. Simulation promotes patient safety. Technology and evidence-based practice and research drive simulation advancements. Innovation will fuel new research, so new research is needed. New technologies will change simulation and nursing education. Overall, what I take from this is to understand the importance of an appropriate level of simulation to meet all educational goals. The most fidelity is not always the best fidelity. As a future nurse educator, this study has taught me that I need to look at the goals and outcomes of particular simulations and then decide which degree of fidelity needs to be used.